enumerate the dosages or amount of the drugs to be used, the length of the study, what the research hopes to learn from the study, the drugs involved, the schedules of tests and procedures, and the types of patients. As you all know, certain medications or devices may target a certain clinical indication or therapeutic area, and so on and so forth. So the protocol is essentially that plan that enumerates all of those steps. Now, obviously, for devices or medications to be approved for use in humans, it ultimately has to be approved by the FDA. And the FDA has obviously then created or led to the formation of signing of this act into law in 2012 that then required, that specific demographic groups are properly represented in the trials. Obviously, in subsequent next slide, I'll actually show some pie chart. But this was born out of the fact that looking at trial data, there was just not enough representation amongst diverse groups. Now, this slide is about, I guess, the most important slide for this presentation in terms of just looking at how groups are represented, for a lot of the medicines or devices that we all use today. So the first pie chart is just the global representation. The second one is the United States representation, and the third one is the rest of the world. But there's something about all three of these pie charts. They look very similar. Over 70% of approved drugs or devices over 2015 to 2019 had participants of European ancestry or whites. Whereas approximately 10 to 15% were, depending on which pie chart you're looking at, the blacks or African Americans, and Asians also somewhere around 5 to 10%, depending on whether the pie chart you're looking at. So what does that tell us? That in our community, we're not participating. Is this intentional? Maybe, maybe not. But we'll dig into that as we go along. This is also a snapshot looking between 2015 and 2019 of the breakdown in terms of biologics that were recently approved in over 30,000 participants. The trials are included over 30,000 participants. For biologics, again, if you look at the fourth line, 76% represented by people of European ancestry or whites. African Americans, 7%, Asians, 11%, and that obviously again shows the disparity. When we talk about newer therapies, targeted therapies today, tend to hear of these genomics and biologics, and it's telling us that even in modern times, relatively, there's still very limited participation or spread in clinical trials. And obviously, without even providing any data, I'm sure that we would all agree that this would have effects in our community, because if a medication, a drug, or a device is not, if we don't have the statistical power in terms of representation when these drugs are being developed, then we would not really have the confidence to say that these drugs will be effective or safe in our communities, in our people, in our relatives, in our families. So that's where this becomes also critical. On this slide, it's a little blurry here, but it's also an example, just looking at FDA data on this snapshot. I'm going to just point to the third row there, popular medication, Mounjaro, very popular these days for diabetes and weight loss. If you also look at that, in terms of the breakdown of demographics, 80% of those who participated in trials were whites, 4% blacks. And again, you know, that just tells you, if you look at the 1, 2, 3, 4, 5, 6, the sixth column where it has the white demographics, some of these medications have as high as 95%, you know, of the participants in those trials as whites. Now, why is this so? We will get to that. Now, this slide then broadly defines, trying to break it down into the question of diversity and inclusion, what it actually means. Inclusion would be ensuring that the end user demographics will be statistically represented by subjects who participated in the study.